out there have had a cavity filled. I know many of you hate this sound. Well, fortunately for all of us who hate that sound, it's becoming a thing of the past. We have a new Star Wars-like laser beam that makes getting the cavity filled absolutely painless. We have Dr. Christina Doe here. She's a pediatric dentist. She's here with her patient, 8-year-old Zach, and Melinda. And Zach, you have no fear, right, buddy?
Zach's an animal.
Hey, what did you tell everyone during the break that you were going to do to me after when we're playing some hoops?
Beat you in basketball blindfolded.
There we go. So he's going to beat me blindfold, but first things first, you're going to be brave patient, right? So this is a painless procedure. You're not using Novocaine.
No Novocaine, no shots. This is a great way of doing dentistry.
In 5 minutes.
In 5 minutes, start to finish. No more cavity afterwards.
Are you ready, Zach?
Oh, yeah.
Open the mouth and let's get started.
Say ah.
Okay, well, let's get started.
I'm really curious to see how this works.
The Waterlase Dentistry is the greatest way of getting your dental fillings done these days. Gone are the days of pains, shots, fillings, where you leave the office with a numb lip and tongue, but now I can get you started from start to finish without a shot, without any fear or anxiety. With the Waterlase, you jump in the chair.
And Zach, you don't want a shot, right?
You sure?
Of course not.
You want one? No, you don't, right? So you're not going to get one. That's the beauty of this.
Sweet.
Yeah. So the Waterlase is just like a water gun. Squirts water into the mouth, chips away the decay, and then the cavity is all gone. The patient feels no pain, is nice and comfortable, and wants to come back to the dentist because he had the best cavity filled ever. So now this is a great tool for adult patients too. They can also hop in the chair, get their fillings done, and leave without having a numb lip or tongue.
So you're actually doing the drilling right now?
Yeah, so immediately we just put our patient down and get started. So Zach, I'm going to use my water gun to take out all the decay, which are the sugar bugs that eat at your tooth. So the sugar bugs, which is the plaque and the bacteria on your tooth, is like a mushy type of material. And because of this, there's a lot of infection in the tooth. And eventually, if you just leave the decay there, which happens to a lot of patients because they're so scared to come to the office, they end up needing a root canal, which a lot of times we don't want to have a root canal. So this is the best and easiest way of prevention to take the decay out in its earlier stage without having to get a shot. So the laser is inside this machine here, and it comes out as a beam of light and breaks off the water molecules. The water...
So that noise right there is the beam.
Yes. So, yeah, the zapping sound.
Wow.
But
And you don't feel anything, right, Zach? Doesn't hurt at all?
So in actuality...
Wow, that's cool.
So the Waterlase is like a high-power water gun or hose that chips away the decay and ends up removing the decay. So what's really nice is you can have a very conservative restoration just by using water to take out the cavity. Once I know I'm back into hard tooth structure, that means we removed all of the cavity, which is great. Zach, are you doing okay? Okay, so all the cavity is gone because now I have a rock solid hard tooth.
The cavity's gone?
The cavity's all gone.
So now we're halfway done.
Now we're halfway done.
The bad part's gone, and now we have to seal it.
This is the easiest part. This is the sealing part. So, Zach, we're going to paint your tooth in 4 different layers. So first what we're going to do is we're going to use a material called etch. Etch is like a soap that cleans off the tooth, which is really great. So that way you sterilize the area that you're working on. So that way you can ensure that your cavity filling is going to last you a lifetime. So we leave the etch on just for a few seconds, and then we go ahead and rinse. So now the second layer of tooth material that we're going to use is called the prime. The prime is what kind of prepares the tooth structure to receive the composite resin. So in the past, we used a lot of, dentists used a lot of material called the silver filling, which is that amalgam, the old, ugly silver fillings that you have in your mouth. So now we're priming it. That's the first layer. Now we're going to go to the second layer, which is called bond. Bond is a layer that prepares the tooth to, like a glue, that attaches the composite resin to the tooth structure. And so we also have something we call the magic light. It's a blue light, and it hardens the tooth surface. So once we put our composite resin in, it starts off as a putty material, very liquid-like, and then with the magic light, it hardens it up.
Are most dentist offices going to have this Waterlase? Or is it still pretty new?
A dentist has to be well-trained in order to use it. And dentistry, you know, we want to be on the cutting edge of technology.
Now, is there any solution for the sore jaw when you have your mouth open like that for so long?
Well, that's why we're using a tooth pillow. A tooth pillow kind of cushions how long you're open. But for us, luckily, with the laser filling, it's really quick. We're going to have Zach bite on this blue paper. A lot of times you see your dentist using this just to make sure they've built it up perfectly. Go ahead and chew for me, Zach. Chew like you're chewing bubble gum. Good. Good job. Good. And open
And
for
Zach,
me.
you feel good, right, buddy?
Perfect. How does the bite feel?
Good.
Good.
Well, Zach, since you've been such a good sport, here's your own basketball signed by all the docs, all right? So you can beat me blindfolded with it. Thank you so much, Dr. Rowe.